I'm Daniel Garza, and welcome to a very special episode of Put It Together Conversations. I'm part of one of the ambassadors. I'm one of the ambassadors of Positively Fearless. And just so you know, Positively Fearless is a campaign that's redefining what it means to live with HIV and showing others what is possible when you live Positively Fearless. In case you didn't know, this year marks the 40th anniversary of the HIV/AIDS epidemic. And to recognize these important milestones, we'll be shining a light on the beautiful and special experiences of those living with HIV. And to kick things off on this special series, I have been joined by a very good friend, Jose Carreras Rivera. He's the Medical Affairs Senior Manager, and we're going to have a special conversation about HIV. And for those of you that don't know, I've been living with HIV for the last 21 years. So we're going to take a stroll down my story with HIV, and my friend Jose is going to join us. So let me bring him on board. Jose Carreras, bienvenido al programa. How are you doing?
I'm doing great, Daniel. Thank you for having me.
My pleasure. Thank you. So people know a little more. Dinos, ¿quién eres? Tell us a little bit about who you are.
Yeah, so I'm a physician by training. I used to work on HIV for around 8 to 9 years as a HIV specialist and as a primary care provider for HIV patients here in Puerto Rico and the Caribbean. I also did research on HIV, so I had the pleasure to participate in a couple of clinical research when I was in practice. After that time, I decided to come into the industry, and that's what I'm doing now. Like you said, I'm a senior medical affairs manager, Janssen Pharmaceuticals.
Excellent. And I want to thank everybody over Johnson & Johnson, the HOLA program, for making this possible also. So thank you, everybody who has been working so hard behind the scenes to make this possible. I want to remind you also, if you're watching on any of the 4 channels, Facebook, YouTube, or Twitter, or LinkedIn, that you can be part of the conversation. So please, if you have any questions or comments about anything we're talking about, please join us and ask the questions. And just as you saw in the video, I want to show this disclaimer again, that as a reminder, we ask that you please refrain from discussing or asking questions regarding personal medical history or specific treatments. If you have treatment-related questions, we encourage you to speak with your healthcare provider. What may work for some people may not be right for others. So we encourage you to seek treatment from your doctors. So vamos a empezar con la historia. Let's start from the beginning. And as I go along in my story, now I want to refrain. If you see me a little nervous, this is our very first episode of this series, and I'm very excited to be able to see where this goes. So please join in the conversation. But pardon me, there's a policeman outside, so I hope they're not here for me. Let's start with my story, and Jose is going to join in and kind of break down some of the things that happened along my career in HIV and how those things affected my HIV status. So for instance, let's start back in 2000, September of 2000, when I was originally diagnosed. I was diagnosed with AIDS. Now, many people ask, are you sure it was AIDS and you were not diagnosed with HIV? So what marks that difference, Jose? What marks the difference between being diagnosed with HIV and being diagnosed with AIDS?
Yeah, so that's interesting for you to bring, because many people just use HIV and AIDS interchangeably. They think that they're the same thing, but they are not. So people get infected with HIV, they could get AIDS. And that to get diagnosed with AIDS, there have to be some specific characteristic, like your immune system is very low, so your cells that defends you from other infections are very low, or you have some, like we call opportunistic infections, that usually happens when people have immunosuppressive disease or system.
Right. So by the time that I went to the hospital, I had a stomach infection. I was starting to lose my hair. My memory was losing a little bit. The muscle mass in my legs was starting to go away. I was weighing 110 pounds, and my T cell count was 108 by that point. So I was very sick, and that's what makes HIV AIDS, correct?
Yeah, so usually when you have a CD4 count less than 200, you already have a clinical AIDS. Yes.
So when I go to the hospital, there were other opportunistic infections that happened. Like, for instance, I was diagnosed with TB, stomach infections. I already had pneumonia. So needless to say, the doctors did not have high hopes for me to recuperate. There was a lot of concerns, especially because my immune system was so torn down. Now, one thing that I want to talk about is that during the time, at that time, I was 29 years old. I was about to turn 30, but I was very heavy in alcohol, drugs, and I smoked. I didn't sleep well. The stomach infection didn't let me eat well. So I was surviving on fruits. And because I had the stomach infection, I would freeze fruit and then suck on the juice. And that's what really kept my nutrients up. And caldos, I would eat soup all the time. And mainly because I couldn't process other foods. But I want to touch on that part because a lot of people don't consider drugs, alcohol, or smoking as something that can affect our immune systems. How does, I mean, we know the logical part, like most people say, don't do drugs, don't smoke, don't drink. Pero for somebody who is dealing with AIDS or is dealing with HIV, how dangerous is that for somebody?
I think that one of the things that we have to put in perspective that drugs not necessarily will cause HIV, but when you are in the effect of any drug, including alcohol, you will get into you will do things that you normally won't do if you're not under the influence of drugs. So that's the main reason that will put you in a risk for getting HIV. The other point is that once that you have the condition, everything that has to do with drugs that will have an influence and will limit or debilita your immunologic system. So that will increase your immunocompromise at the point when you have HIV. So that's important to have it in perspective.
And you're right, because before I was officially diagnosed, drugs and alcohol do lower your inhibitions. They didn't allow me. I'm not going to put anybody else in place. I'm going to put myself in the hot seat. It didn't let me make the right decisions for my personal care, using condoms, having the conversations about HIV, protection. All those things were not part of the equation when I was before I was diagnosed. So just to clarify, and I went to therapy for this, there were conversations had about, were you ever concerned that you could have infected somebody else? And obviously not when I was doing drugs or drinking, but afterwards, once I got sober, that was really a big concern. Like thinking, was I really being safe and taking care of somebody else? Does that make sense?
Yes, Daniel. And something that I would like to say is that the many people, we might think that won't happen to me. That doesn't happen to me. And I drink alcohol. I do recreational drugs. But the truth is that let's think in something not related to HIV, but potentially you go to a party, you have some drinks, and you end up doing karaoke. And you will have not do karaoke if you were not in the influence of alcohol. So that's just a sample of that. When you're in the influence of those substances, you will do things that normally you wouldn't,
Exactly.
Just to put it very simple.
Now we have this question, just to clarify. Does it have to do with the T cell count? I'm guessing that's between HIV and AIDS. Is that the only difference between HIV and AIDS?
Yeah, so like Daniel said, we talk about his CD4 count, and those are one of the types of T cell counts that we have in our body. We have CD4s and we have CD8s, and yes, it is related to T cells.
And then the other question that we are talking about smoking. I have heard that tobacco can have a negative impact on the immune system.
So tobacco is one of the things that have a negative influence in all of our body. When you smoke tobacco, and we are not talking about only cigarette, we are talking about electronic cigarettes and all these modern ways of smoking. The fact is that you have a decreased immune system that puts you in higher risk for a lot of conditions, including cancer. So it does have an effect in your immune system.
And then obviously for somebody who is already immunocompromised, that's even harsher. So just to let everybody know that I don't do drugs anymore. I'm just over 14 years clean and sober, and I quit smoking like 6 months after that. So yes, but it did take a long time. I confess it, and I talk about this in my presentations. I was diagnosed in 2000, and I continued to do drugs and smoke until 2007 when I got clean and sober. So my system was not always great, but I wasn't honest with my doctors about my use. So they could never figure out why my T cell count wouldn't go above 200, 250. And it took years later to finally confess, like, well, I was doing drugs and alcohol. So I was putting my own health, like I knew the risk, but I was still doing it. But then also taking medications, like I wasn't taking my medications on a regular basis either, because I would be drunk or high and I wouldn't think about drinking at night. So más que nada más, like it's more than just what drugs and alcohol does to you. It messes with your schedule, it messes with your priorities, and it did with mine. So it just, I wasn't giving my body a chance to recuperate the way it should. Does that make sense?
Yes, I remember that one time I had a lot of patients that do drugs, and because they do drug, we don't exclude them from treatment. We have to treat them anyway, but it's harsh. It's very difficult for them to keep on and being adherence to their therapy if their priority is to get high.
And talking back a little bit, when I was diagnosed, so I tell people that my muscles were starting to get weak, like my leg muscles. And this is really interesting. I went back and looked at my calendar for this episode because I wanted to be really exact. I was fired from my job as a server. I was a server at a restaurant, and I was still running around and doing all kinds of things at a restaurant. But I was let go. I was fired, and on Wednesday, when I woke up, I realized that my leg muscles were really weak. I couldn't walk much anymore. My mental process was off. We talk about HIV and how it affects your immune system. Are there other parts of the body that get affected when you're diagnosed with it or when you're infected with HIV?
No, definitely. HIV affects our whole body, our brain, our thinking process. It causes a inflammatory process that is generalized. It's not only a matter of immune system. And like you said, there's a lot of patients, especially patients with diagnosis of AIDS, that they lose muscle mass. And that's sometimes we used to call that cadaveric fascia, because when you look at them, they lose all the subcutaneous fat in their face, so they look like a cadaveric face. That was really common at the beginning of this disease when we diagnose patients with AIDS.
Right. Yeah, because like I said, I was not recognizable. People who had not seen me in a long time did not recognize who I am. I've normally in my adult life been somewhere between like 150, 165 in weight, and I've always had my little cheeks. But when I got really sick, it was the first thing that left, and I looked skeletal, and people just, and that was one of the reasons that doctors didn't have high hopes that I was going to make it. Disclaimer, I did make it, so here I am. Pero we talked, like, for instance, I'm also an anal cancer survivor, and we talk about chemo brain, where months and years after you've been through chemo, your brain is still affected by the chemicals. I believe, and I'm very adamant about it, that there is an HIV brain. I believe that when you're first diagnosed or before you're like in treatment, and even now is sometimes, that there is an HIV brain, that your brain does get affected by the virus. Am I right or am I wrong in that?
So early in the epidemic, we used to talk about HIV dementia because those patients really had brain damage. Now we don't see that often with the medications and the treatments that patients get. But what we still see is neurocognitive disease, so related to HIV. So patients with HIV might start having some memory issues earlier than the general population because they have HIV. So that's something that really happens.
And does it eventually go away or does it linger?
So it won't go. It won't get away. Once you have it, you have it. A damage that will occur will stick with you, but we can with treatment and if it's identified early, we can manage to avoid that to progress. Yeah.
Thank you. So before we continue, I want to remind you, you're watching a very special episode of Political Conversations. This is a collaboration between Janssen Johnson HOLA program and the Lilmesican Productions. And we're talking about HIV and AIDS. And just as a disclaimer, we're going to put this up again so that you guys remember when asking questions or making comments. But please, anything along the lines of the story, and even if it's not in our storyline, if you're interested in asking, please ask us. Here's another comment. I think that inflammation triggers so many issues. So many with other autoimmune conditions also cause issues with brain fog. Yes, and like I said, there's HIV, there's chemo when you're going through cancer. Just off the top of your head, is there any other symptoms that may cause that type of mental fog?
Multiple sclerosis might also have, and other autoimmune diseases may also cause this type of, and aging. So aging. So just getting old will give you some kind of issues potentially with age. But in a patient that not only is aging but also have HIV, we have more probability that that happens earlier in their life. Yeah.
No, pues con razón. That makes a lot of sense. At my age, with everything I've been through, no, I'm surprised I remembered about the show. So continuing with the story, just so we can fill in more gaps. So I continued to use drugs. I was smoking. I was drinking. I was not really taking care of my medications. I wasn't being honest with my doctors about what I was doing. So my treatments weren't working. So my medications changed a couple of times during that time. And I've now discovered, and I encourage people and advocate for that you've got to be honest with your doctors at all time. And that was really important. That was a lesson that I learned the hard way, because we changed medications. And although we're not talking about specific medications, I do want to make an emphasis on the fact that as Latinos, because this show is geared to Latinos and Hispanics, that sometimes we're not completely honest with our doctors and we don't say everything. No queremos contar todo, porque I remember my mom saying, te va a regañar el doctor. The doctor's going to get on you because you didn't tell the truth. Why? I want to understand, maybe you have a more scientific reason. Why are we so hesitant as Latinos and Hispanics to not want to tell our doctors everything that's going on in our lives? Like, I used to not tell them that I would drink 10 Cokes a day, or like all the tortillas I would eat. From your side, do you understand like sometimes why we're so hesitant in sharing?
I really don't. Like, for example, I don't know why us as Latinos are not, we don't. I always tell my patients that there are two people that you have to tell the truth: your lawyer and your doctor, because those are the ones that are gonna get you out of trouble. And when you talk to people like, okay, so you ate some candy or just a little, but a little for us as Hispanic might be like I have a fist on that. So I really never understood why people won't speak to what they're doing. But then there is a responsibility of the physicians, of us as physicians, to ask the right questions, to try to, because it's not like, okay, are you doing good? Maybe you will say yes. But if I say, are you having pain? Are you having trouble taking your medications? Those are more specific words than just, are you doing good? So
yeah. I also found out. I mean, during my first several years of being diagnosed, even though I'm considered first generation because we moved here when I was very young and I grew up in the States, como quiera, la mentalidad, that mentality of the way my parents brought me up to not, like, don't tell the police too much, don't tell your doctors too much, no hables de todo, keep some things to yourself, not trusting the government and doctors all the time. Nomás vas al doctor a enfermarte. That would be my dad's thing. We're just going to the doctor to get sick. And I was like, how is, like, no, you go to the doctors to, like, but even as an HIV, as a gay man, I was almost 30 years old. I call it selective ignorance. I was selective in what I wanted to know about HIV and what I didn't. I guess in lieu of the shows today, because we want to talk to the Hispanic community, as somebody in the professional side, is there an understanding of the culture? And I think that's where my question was going, is, porque a veces vas con el doctor, we go to the doctor, and I remember as a kid going to a white doctor, and he wouldn't understand, like, we eat chile with most of our foods, or like the tortillas, and almost every meal had rice and beans, and they were like, eat less carbs, and we're like, rice isn't a carb, like it's food, like that's what you eat. Is there an important way that doctors can ask questions or to reach the Latinos that don't know how to express themselves? I don't know if I'm making sense of the question.
I think yes, you are. I think that we have to culturally understand the patient that we have in front of us. We know that sometimes patients can feel anxious. They can mistrust their physician because they think, he's just gonna give me drugs. He's not hearing me. He's just gonna prescribe something that not necessarily is attending my needs. But it is important for us as a physician to try to understand. And I encourage our Latino audience to speak to our doctors, speak to your doctor, and teach them about our cultural differences. That's something that we can proactively as a community do to help doctors and physicians to better approach our needs as a community.
It's like Stella's saying, I think it's in our culture. However, the providers are more aware of different cultures, then they can address their patients accordingly. And we have another comment here. It says, I always tell my husband to tell the doctor everything. Sometimes I think I get on his nerves, but it's important for the doctors to know everything. And I mean, as doctors, I feel like you're not supposed to judge us, but it does change. And going back to HIV, I think that was one of the things that as Hispanics and Latinos, it's not something that we talk about on a regular basis. I mean, I've heard people talk about cholesterol and diabetes and engordé un poquito, I got a little fat, but we don't talk about HIV and AIDS. Have you found a way to culturally be more open about that conversation with patients?
So I'm a little bit biased there because most of my practice, great part of my practice was in HIV. So I felt comfortable having those conversations. I felt comfortable talking about sex with my non-HIV patients and asking the questions, asking about risk. One of the things that, like, I used to joke with some colleagues who I gave some talks about HIV back there, that sometimes we get a patient with a viral infection, but this is the old lady, Doña Toñita, that seen me grow in the barrio, and how dare I will ask her if she's active sexually. I won't dare to do that. And because of that taboo, we don't get into the conversations that might potentially get us to diagnose a patient earlier in their disease. So that just pass away as a viral infection that 10 years after that, turns out to be HIV and potentially a diagnosis of AIDS.
Here's another comment. Definitely, it takes two to tango. Yes, it does. We must both communicate, the care team and us as patients. Building trust is important. And I think, yeah, pero como dices tú, like you're saying, like, how do you talk to somebody that you've known for so long? And for those of you watching, there are increase in numbers, not just in younger people, but in the older generations with HIV and STDs and STIs. And that's something nobody wants to imagine Abuelita Toña having sex still at her age, but it does happen.
Yeah.
So continuing with my story and adding to it, when I was diagnosed, as I said, there was this selective ignorance. There were things that I just didn't want to know. And I think part of my lack of sexual knowledge really came because when I came out at 17, which is normally when your parents would have that sex talk with you, I think that me being gay stopped my parents from telling me about sex and how to take care of myself. Because I think they were prepared to talk to me about, don't get a girl pregnant. Like, don't. Wear a condom. But the moment that they know that I'm gay, I don't know. My mom passed away last year, and my dad and I have still not had the conversation. I'm 50 years old, and we still haven't talked about it. But I feel like there's something switched in their brain that didn't allow them to talk to me the way they should have about sex and sex education. Aparte, let's talk about the culture and the religious side of it all. It's like, you just don't have sex till you get married, and then you're gay, so you're probably not going to get married. So why have that conversation? But from the professional standpoint, is there different conversations for different children? Does sexuality really define how we should talk to children about sex?
No, sex. So we should have a conversation about the risks of having sex, whether it's a heterosexual, bisexual, homosexual. It's about risk. If we don't educate, someone will do, and they won't probably do the right thing or give the right information to our kids. So it's really important that us as Latino do have those conversations with our kids. Yeah, definitely.
Yeah, porque se mete lo religioso, you start talking religion, and it does. I do feel like there's this. It used to be double standard. You would have the one talk with the girls and one talk with the boys, but then when young gay people like me started like really being open, there was a triple bias conversation. Like, there's one conversation for the boys, one for the girls, but nobody knew how to talk to the gay boys. And like, you still have to use a condom, you still have to be protected. And I finally, it took me a while to realize that it was just the culture, it was la cultura, la religión, la familia. We just didn't know how to talk about it. And I wish as an older person now that we had that conversation with my mom and my dad, and they had taught me some more stuff, which is probably why I'm an educator now in schools, is I want kids, other Latino kids or Hispanic kids, to not miss out on that information. As a doctor, what would be something that, like, for instance, that you would tell my parents on how to talk to me about sex?
So sex, like I said, when we have a conversation about sex, we have to just put into perspective what are the risks of having sex. It's not only the only risks that our parents probably had in their mind was getting somebody pregnant or getting pregnant. Yeah. That's the only risk. But there is much more on it, like getting an STD, having a strong relationship, if that's what you want. Being able to say no when you say, when you don't want to have a relationship. So that kind of conversation doesn't have gender, doesn't have sexuality around it. It's just about what are the things that you have to do. Like you say, you need to wear a condom. It's not because you're going to get pregnant or you're going to get somebody pregnant. It's because you have to take care of yourself, and there are some risks if you don't use a condom.
Exactly. Thank you. I want to remind everybody you're watching Putting Together Conversations. This is a special episode between Janssen, hello, I'm sorry, Janssen, hola, and Lilmesican Productions Inc. And today's episode is HIV and Hispanics. And remember, if you want to join the conversation, be sure to ask questions or make your comments, and I'll make sure to show them up here. We have another comment on another question. How can the topic of contraceptives be approached with the Latinx community? How do you help or assist the parents with their social cultural issues regarding sex? Ooh, big question for you.
That's a hard one, and I still don't have a magic recipe for that. But I think that it's about honesty, is about having that confidence between parent and kids, about knowing the risk, about understanding that things have changed, and our kids are sexually active very, very early in their life. And that's a reality that we have to face. And it's a matter of whether you want them to engage in that with the knowledge or without the knowledge that you can provide.
Yeah. Oh, como dicen, mandas a los hijos como dicen, mandas a los hijos sin guerra, sin pistola or something like that. It's basically sending your kids out to war without a rifle. So continuing with the story so we can add more to it. During time, there was this stigma and shame in the community. There was this idea of HIV being contagious, how it was spread, the rumors, the myths, because we all heard about those like in the 80s and 90s, donde no toques a nadie, don't touch them, don't breathe next to them, silverware plates, sheets. How have you over the years been able to change that mentality in people? And has it really changed much over the last 40 years?
No, there's still a lot of stigma around HIV, and unfortunately, there are a lot of people that at this point they will not change their mind. But it was really interesting when I was in practice to see all people that were HIV positive not being able to grab or hold or give a hug to their grandson because they thought they were going to infect their grandson. So one of the things that I make sure is that every patient that get into my office was educated around HIV and understood their condition. I could not expect them to do something for themselves if they do not understand their condition and the risk around their condition. I always will tell them, when we talk about blood, you don't cut yourself and bring people, touch my blood. That's something that's the first thing that you're gonna do is you're gonna cover your herida, your wound, and you're gonna clean the and disinfect where the blood's. That happens whether you are HIV positive or HIV negative. So there's nothing different there. But I had stories of patients where their family will clean everything they touch with bleach. So if they have a cup, they will clean it with bleach, and that's not only within the community. That also happens, unfortunately, in physicians. There are still physicians that do not know how to deal with HIV patients that still have a stigma on HIV.
Yep. I remember the first year that I was diagnosed, because of the medications that I was taking at the time, they created kidney stones. So I had to go to the hospital to get pain medication and get help. And the intake office was fine. They filled out my paperwork, any conditions. I'm like, I'm HIV positive. Cool. They send me back to the emergency room, and the nurse that saw my paper, you could see her read the whole thing, and down at the bottom when she saw HIV, she immediately put me in an isolation room, and they shut the door so that I would not be around anybody else. And I was in pain. I was hurting, and she would come and look through a window and leave. And I thought, this is a nurse. This is a nurse that's supposed to know and be educated. And she was treating me that way. Again, another point in my life where I was like, I need to educate people. I need to tell people how it is. But for those of you that, yes, a lot of things have changed over the last 40 years. And when it comes to education and the way we treat people with HIV, but not everybody is either up to date on the information or acknowledges the information. And I think this is el más duro. That's the hardest part. Is not that the information is not out there, is when people don't acknowledge it and they still want to treat you like they did back in the 80s. Does that make sense?
Yeah. Yes, it does. There's just people that they don't want to deal with that,
And yes, you're welcome. That's our pleasure for having this conversation. We want folks, precisely because we understand that even 40 years later, it's weird that 40 years later, we're still having talks about stigma and shame, especially in the Hispanic community, that we should be more advanced. And pues no estamos, so we're trying to get everybody up to date, folks. Another thing that happened while I was going through HIV, when I was first diagnosed, was mental health. And a lot of people think not just about the HIV brain, but the stigma that comes with it, the shame that I had for myself, the embarrassment of how my family and friends were treated because they were near me. Because it's the ripple effect. La gente es mala a veces. They don't just, like, they're not just mean to me, they're mean to my family. They'll start putting people aside, and that's a lot of pressure for a person with HIV. So I had to go to therapy and make sure that I had somebody to talk to. And a lot of times the conversations were not even about me and how I saw it, but how it affected the people around me. How important is mental health, taking care of our mental health when we're newly diagnosed or long-term survivors with HIV and AIDS?
I think it's as important of taking care of our blood sugar as de nada. That's my mother.
Oh, he said, hello.
So it's as important as taking care of our cholesterol, of our blood sugar, because many things that we don't treat on time mentally, when we have some issues like anxiety, depression, they will eventually transform into something that is more organic. So it is really important. All of my patients needed to see the psychologist when they get into the clinic, because I think it was most important, especially like you said, HIV patient that is dealing with a new diagnosis, with the stigma that brings. Let's put that is a gay person, and on top of that, no, he's getting 8 pills a day. He doesn't know where to put those pills. The anxiety that brings to that patient. So just look into this patient like in the 90s, trying to deal with all of that at the same time. They will get anxious, they will get depressed, and there is a lot of scientific information that HIV patients are more impacted by health issues and disease than the general population.
Yeah, when I was going originally treated, I also had TB. So the health department would come to your house to drop off the meds. And then once I wasn't contagious anymore, I was able to go volunteer. They would come to where I was volunteering. And I always tell them, they were like, como perros, te encontraban donde estabas. They would find me anywhere I was and make sure that, like, here's your pills, take them in front of me. You had to take this handful of pills. And it was embarrassing. It was stressful. No matter what I was doing, I still felt like I was contagious. And la palabra enfermo, estaba enfermo, I was sick. And to this date, I usually just take pills at night, but my alarm goes off at home. I have a Google alarm that goes off every midnight. But no matter how much I've done in the day, I always have that reminder at night that I'm HIV positive. And it's always a constant reminder. And it does mess with your head because you're having a great day. I'm watching a movie, todo perfecto. And then midnight, like Cinderella, time to go home. Like, did you forget you're HIV positive? And even after 21 years, it still messes with my head sometimes. And we have another question for you here. How can the DALB move forward within the Latinx community with regards to mental health? How can we start chipping away at the keep our problems at home societal norm?
Yeah. Los trapos se limpian en casa.
Claro.
I used to say. I think that's something that we as patients, we as physicians and the healthcare community need to normalize going to the psychology. We need to normalize going to the psychiatrists, and especially in the Latin community, we are like the psicólogo y el psiquiatra son palos locos. No, we have to take care of our mental health, and we have to normalize that. I think it's something that we have to, like, I remember if somebody went to the psychologist, we will bully that person like, está loco, So we have to stop doing that and normalize that, he's taking care of his mental health. That's good,
Yeah. Que viene siendo, I mean, it's not that much different than when my parents would go to church and talk to the priest and talk to him about their issues. Except when you go to a therapist or a psychologist, or they're going to offer you medical.
Yeah, or you go to the dentist because you have a toothache, or you go to the, it's just taking care of something that is happening to you.
Yeah, I'm very happy that I've seen a lot move forward. In taking baby steps, I understand some people don't like going to the one-on-one therapist, but there's all kinds of support groups. There's all kinds of grupos de apoyo where you can go and be around people and a therapist and be able to start the conversation. And then from there, you can take a baby step next to your therapist. O sea, no tienen que hacerlo todo de un tiempo. Take your time in getting there. I want to remind everybody watching, you are watching a special episode of Put Together Conversations, and want to remind everybody about if you have any specific questions, please seek your doctor. And this is, for those of you, a collaboration between J&J Hispanic Employee Resource Group, HOLA, and Little Mexico Productions. And also a reminder that we are going to have, and I'll show you some more of those, we're going to have a series of episodes. So we have mental health, cancer, and stigma and shame in the community. So those will be coming up soon, and I'll show you that lineup pretty soon. Dice, another comment, sí necesitamos tener estas pláticas y educación en nuestras comunidades para poder no solo aceptar estas enfermedades, pero saber cómo apoyarnos unos a otros. Tantos pacientes que tienen que esconder sus enfermedades y tratamiento, y eso causa mucho estrés. Sí, mental health is important as physical health. Yes. For those of you continuing the story, we're in the last 15 minutes. Thank you for joining us. So 21 years later, I'm not taking as many medications as I used to. I have a better understanding of what my body needs and does and how to treat it. One thing that has changed, though, is the way that I relate to my healthcare professionals. I try to establish a good relationship with my doctors. Y también, muchas veces, como Latinos, we're like, lo que diga el doctor, lo que diga el doctor. What the doctor says, tómate la pastilla, don't say anything. Ay, pero es que, like, me da asco, I'm be throwing up with the pills. ¿Qué importa? You keep taking it. And we never questioned anything. And I learned over the years that it's okay to ask questions from my doctor. It's okay to say, hey, I travel a lot, or I'm busy. I can't have refrigerated medications because I'm in the car all the time. What you're giving me is hurting me. It doesn't help, or it's causing me stress. Do you find that Hispanics are open with you, or do you need to teach them how to open up to you?
I think it's something that there were patients that they were really open with me, and some others I have to gain their trust to have them be open with me. But like you said, sometimes they will come and they were used to have, just follow instructions. This is your medication. No matter what, you have to take this pill. This is what's gonna get the virus control. And as far as it does that, it's good. And they will have side effects, and they won't speak about their side effects because this is what the doctor gave me, and I have to take it. And sometimes, talking about mental health, they will say, I'm having these side effects, but I deserve it because I have HIV. This is what I deserve to have. So all of that, I had patients that I had to go into their mind and let them know that nobody decide to get infected. Nobody decides to get diabetes. Nobody decides to get, you might have some risk in your life, but that doesn't mean that you were looking for that disease. You weren't looking to get HIV infected. So it's not a matter of I have to deal with this because I'm HIV. And that's something that when you get the trust and they start talking to you, then you could do something better. Okay, so you have these side effects with your medication. Let's talk about that. Let's manage those side effects. If we cannot manage those side effects, let's change the medication. Let's try changing the medication, and we can still have your virus control, but with the side effects. But if you don't have that open communication with your physician, it's really hard for them to really see how they can help with the things that are happening.
Yeah, and like the comment says, we definitely need to overcome the revere fear, the doctor mode, and transition to teamwork. Yeah, I'll tell you all this quick story. My current doctor, when we first met, was very serious and no se reía. He didn't. I'm always very sarcastic, and I try to be funny in my sessions, and he would not laugh. So at the end of the session, I told him, Doctor, I don't think we can see each other anymore. I don't think this relationship is going to work. And he got me like, what do you mean? I said, I think we need to break up. You're not the doctor for me. And I'm like, I'm going to kick you off the island and you're not getting a rose. And he looked at me and he's like, I don't think I've ever had a person talk to me like that. I go, well, I'm giving you my best jokes and you're not laughing. And if you can't laugh with me, I don't know that you can be my doctor. I'm like, everything is always so serious. I don't want to come to the doctor's office and be serious the whole time. I said, so if you can't laugh, I'm going to have to find another doctor. And he looked at me and goes, I have never had anybody say, I want you to laugh more in an appointment. I said, pues así soy yo, either deal with it. So the second appointment, when I came in, I hear a knock at the door and I'm like, come in. And he doesn't come in. Knock on the door and I'm like, come in. So he opens the door a little bit. He goes, knock, knock. And I'm like, now his last name is Dr. No. So he opens the door and he goes, knock, knock. And I'm like, who's there? And he's like, Dr. No. And I'm like, Dr. No who? He goes, well, if you don't know, I don't know either. And I started laughing. I go, that is the dumbest, funniest joke I've ever heard in my life. But that completely set our relationship. Now he knows how to treat me. I know how to treat him. When he needs to get really serious, he'll say, this is serious. And he'll tell me what he needs to tell me. Otherwise, we go in. My last scans came out really great. There was no big issues. So I go, well, if my scans are good, then what's wrong? And he goes, well, you're just a big whiner. And I was like, oh my God. I said, you're funny. But that's the way he treats me now. But I had to set that tone for myself. Does that make sense?
Yeah. So it needed he just needed to open, and then he just flow with that. He understood that he needed to change his way, and I think that type of dynamic, and you have to be, patients have to be understand that not all physicians will fit for them. That's something that's going to happen, but you have to find the one that you're comfortable, that you feel that you can trust, that you can talk about everything and tell him or her everything, in order for that relation, like you said, to work.
Yep.
If you don't have that trust, that relation won't work.
Yeah. No porque la comadre te
he can give you like a miracle pill and you won't take it because you don't trust him.
Yeah, I say no porque la comadre te dijo del doctor, you have to go to that doctor. Like, not because your best friend told you that. Like, you can pick your own doctor. So if you have the opportunity, pick your doctor. Like, make sure that you're comfortable. Part of the show tradition is to ask some words of wisdom of our guests. And in tradition of all our shows, what words of wisdom do you have for us, Jose Carreras Rivera? Did we lose him? I think we lost Jose, but while we do, I'll show this comment. This is an amazing story. We're all human. Trust and respect goes a long way within relationship with your care team. I lost you there for a minute, Jose.
Yeah, I have a connection issue. We're live.
Yes. I was like, he's thinking really hard. But part of the tradition is to share some words of wisdom. ¿Qué palabras sabias tienes para la gente?
Thank you.
No, digo, what words of wisdom can you share with the audience?
Okay. So one of the things that I would say, first of all, when we talk about HIV, the best thing to know is your status. So don't fear to get tested. And you only need to have one risk factor, one event to be positive. So the best thing that you can do is get tested, know your status, whether it's positive or negative, then you will have the power to do something about it. Whether you have risk, take care of that. Let's see what I can change or what I can do. There are medications that might be suitable for a patient that is in continuous risk. And if you're positive, then you can have treatment and avoid a lot of things that HIV will give you with time if you don't know, and you might even be diagnosed with HIV 10 years from your infection. So I think that's one of the things that I would say. And on the other part, if you're HIV positive and you're on medication, it is really important to be adherent to your therapy.
Thank you.
Don't stop your medication unless you are in communication with your physician. He tells you to stop them, because this virus can develop resistance. Then your medication and other medication might not be useful anymore. So it's really important to keep on your medications, talk to your doctor, open that channel of conversation, and make, like you said, make that relationship work.
Yeah, it's like this comment says, patients and doctors need to have a sense of humor, be transparent. Sí, hay que reírnos de vez en cuando.
And we as Latinos, we like to laugh. We like to, I don't know, in other Latino communities, but in Puerto Rico, like just having the doctor, touch your shoulder, that's something good. You feel like you're more than just doctors. He's part of the family.
Yeah, esas relaciones son muy importantes. The relationships are so important to have, and it doesn't matter. For me, it doesn't matter if I've been with my doctor for a month, or like my last doctor, I was with him for 7 years. At any point in that relationship, as the patient, we can make the switches we need to adjust to us. But sometimes we don't feel comfortable. We feel like, why should I question my doctor? Él sabe todo. He should know everything. But you be in touch with your body, and you should know. So I've been asked to make a comment on words of wisdom on my end. And the best thing that I can tell you folks, as far as as a 21-year HIV survivor, the words of wisdom that I can tell you is, I can't promise you how successful you'll be. I can't promise you how far you'll advance in your personal or professional life. I can't give you any guarantees. The only things I can tell you is that if I make the right changes, if I make the right choices, if I choose what's best for me to become a better person mentally, physically, and spiritually, then I will succeed in life. And the success is only measured by you. I can only measure my success. Everything that I have done in my life, I just turned 50 last year, and everything that I've done in my life has been not calculated, I will admit. It's taken some tumbles. I've fallen a bit, but I have a great support system that helps me get back up. I have a great group of healthcare professionals that guide me in the right direction. And I have me. And as long as I have me first, and I think about how I can become better, then everything else falls into place. So my words of wisdom to you, person, if you are HIV positive, put you first. Think of you first. How can you be better? And then the team and the people will fall into place around you. And I know my healthcare professionals want me to be healthier. They want me to be better. So pick your doctors well. Pick your doctors. Tell them a joke. If they don't laugh, sálganse. No, just kidding. Because what if your joke is bad and they just like, no. Let me remind everybody before you go, I want to show you, we have a schedule. We have more shows. So if you're watching this on replay, make sure that you come back and watch those shows. We have October 19th at 6 p.m. Eastern Pacific time, Cancers, Myths, and Facts. On October 26th, Mental Health Secrets. And on November 6th, Studies and Surveys in the Hispanic Latino community. We'll have experts coming, guest speakers coming from Johnson & Johnson to talk to us about that. So make sure that you come and join us. We have one more comment before we go. Thank you, Daniel and Dr. Jose, for this great conversation, for the great tips, and most importantly, for being such a great presentation of our Hispanic Latino community. Pues ya saben, aquí estamos, para eso estamos. We have a couple of minutes. Anything else that I might have not touched on before we go?
No, I think that one other thing that I will add is every patient has the power to control their disease and not let the disease control their life. I remember that I stepped into many patients in which they were like incarcerated by their disease, and that you cannot allow that to happen. You know, you have the power to control this with your healthcare provider, with that circle of support, and do that. You know, control the disease. Don't let the disease control you.
Yeah, that's such a people have been saying that for a long time. I'm Daniel Garza, and I live with HIV. Not HIV controls me. I live with it, and it does most of the time what I ask it to do, and as long as I take care of myself. But Jose Carreras Rivera, thank you so much for taking the time to come on the show. I so appreciate you.
No, thank you for having me.
For everybody watching, we will one more comment. Our diseases do not define who we are. They're just a part of our lives. Like my sister says, we are the CEOs of our bodies. Let's take charge. That is a great ending to the show. For everybody watching, remember to come and watch us next week. Same time, same stations. We will have the cancer conversations next week. I want to thank all the folks over at the J&J Hispanic Employee Resource Group. HOLA. Gracias por todo su apoyo y por toda su ayuda. If you are watching again this on replay, make sure that you follow us. If you're watching us on Facebook, LinkedIn, or Twitter, stay tuned for more shows. If you're watching us on YouTube, do me a favor, scroll down, hit that subscribe button, hit the notification bell. It'll let you know whenever there's a new show on the air. And we hope you'll come back. Thank you for everybody who commented and asked questions. And we'll see you next time. Bye-bye.